For FUE surgery, I often get asked, "Hey doctor, do you need to shave my head?" So let's go through the different ways that we can prep the hair prior to FUE surgery. Keep in mind that for FUT surgery, which was much more common in the past, there was no shaving at all. Only the area that was the strip that would actually get removed. But in general, it was very common not to shave the donor or the recipient area. Whereas with FUE, it's very common to shave the whole head. And I'm going to discuss the donor area and the recipient area separately, so you can see the different variations of how the hair can be prepped for each of those areas with FUE surgery. Now let's start with the donor area. What are the different ways that you can prep the hair? The first one is shaving the donor area completely, and that's, I would say, the most common way that we do it in the practice and that you see sort of all over the world. What that allows for is for you to basically, as the surgeon, have a nice open area where you can really see the densities quite well, and it's much easier to harvest the hair when it's cut nice and short. Now, while it's easier to do the harvesting, it's also the most obvious when it comes to the healing process, right? Because after surgery, it's pretty obvious that someone had something done because now there's a big shaved area. So if someone's used to having their hair longer in the back and now there's this big area that's shaved, surely they have to do something to cover it up or explain to people that, hey, something went on. Another option is a partial shave. Now what that means is usually the lower part of the occipital scalp or the donor area is shaved down. And that is good for smaller cases where your overall graft number is lower. So you can just get it from that lower portion, and it's easier to cover up because if you have longer hairs above it, it almost covers up that whole section of the lower back of the head. Now another option, going in order of most shaved to least shaved, is called band trimming. And what that is basically cutting. You can also shave the band, but you can also just use a scissor to trim the band. And there's like these 1 to 2 centimeter bands that are trimmed down throughout the back and sides of the head. And if someone has long hair, it can actually cover those areas quite well by just draping the hair over those bands. And within the bands, you can do your FUE random extractions. And this is, again, effective for people with longer hair, and we can usually get up to 1,600 grafts approximately per session using that technique. Now, another option is to do a no-shave technique, and that is a lot more challenging. And basically what that means is trimming down only the hairs that you plan on extracting. And we can usually do up to maybe 1,500 grafts. Usually I like to quote closer to 1,000, 1,100 grafts, but if we really push it, we can get to 1,500 grafts for most patients per session. And keep in mind that the most common way to do no shave is to still trim the hair that you're about to extract out. But there is one other method, which is no shave long hair technique. And what that is the same as the no shave. However, the hair length, the shaft of the hair is kept long. And so you need the proper punch to be able to extract out the graft with the longer hair coming out of it. Now, what's the reason for doing it that way? Because that makes it even more difficult to harvest. But the main reason is there's this idea of preview FUE, which is that if you're taking these longer hair grafts and you're placing it, say, in the front of the scalp, you now have a sense of what your final result over time might look like. And so if you do it that way, you do get like a preview, and that could be emotionally very exciting for patients at the end of the procedure, because now it looks like how it will hopefully look a year later. But you can't guarantee that all of those grafts will necessarily survive. You have to be more careful. It's not a very common offering, especially in the States, but definitely a very labor-intensive process, and a process that usually doesn't allow for a very significant yield of grafts in a single session. Now let's talk about the recipient area and what the options are for prepping the hair. The first option is, of course, to just shave the area. And again, most FUE surgery is done with a full head shave, at least in most parts of the world. In our practice, we usually don't shave the recipient area, but we sometimes do. Even though it's the most common way of addressing the recipient area, the disadvantages are that the directionality and the angulation of the existing hairs in the recipient area that you're about to work into are a little bit more difficult to judge, I find, when it's totally shaved down. But it definitely makes the implantation process go much smoother. Another option is to use a scissor to just cut down and trim down the hairs in the recipient area only. And this allows you to maintain longer hairs in the area that's not being worked on. So for example, let's say we're working just on the frontal scalp, so we can trim down those hairs, but we can leave the hairs in the mid-scalp still longer, so people can camouflage the grafted area in the recovery process better than if we just shave the whole head. And then lastly, there's the option of leaving the hair at the recipient site long, and we frequently work with longer hair at the recipient site. Now this, I think, is better for judging the overall direction and angle of the hairs, so you can best match that when making and creating the recipient sites, but it can be technically more challenging to work between the existing hairs when they're long and to judge density properly. So those are some of the downsides of keeping the hair long at the recipient area. So there you have it. Those are the different ways to address both the donor area and the recipient area when it comes to the existing hairs in those zones when you're doing hair transplant surgery with the FUE technique. Check out the rest of our hair transplant playlist here.